Well, May is Osteoporosis Awareness Month, and many people don't like to think about it, but bone health is an essential part of our life. So this morning, we are joined by Medical Director Dr. Biz Misra from Stanford Health to talk about osteoporosis prevention. Thank you so much for being here this morning.
Thank you for having me.
So this is something that primarily affects women. Why does it affect so many women versus men?
Well, estrogen is a really important part that protects our bone health. When we're young and we start having our ovaries produce estrogen, it helps with the remodeling process of the bone. So we're always building bone and we're always losing bone in a nice balance. After menopause, estrogen levels decline and our bones start to just mainly lose and go in the wrong direction.
How many people does this affect in the state?
I don't know in the state, but in the United States, up to over 50 million Americans have either low bone density and are at risk of developing osteoporosis or are already osteoporotic.
Wow. And what does that mean in terms of what could happen to them?
Well, fractures, and that's what we worry about most as doctors. And I think people don't like to think of fractures as a big health problem, but it's a huge health problem. 1 in 5 people who get a hip fracture can die within the first year after having a hip fracture.
Wow.
So this is why it's something that's very important to doctors. And hip fractures not only, they lead to disability, difficulty with activities of daily life. So it's something that's very important to keep people are living longer and to live long and healthy lives.
So how can we prevent osteoporosis?
That's a great question. I always sort of give my top tips to my patients of what to do. I always tell people start thinking about your bone health even with your children. Recommendations from the American Academy of Pediatrics recommend vitamin D supplementation, starting if the babies are breastfed, so starting from the time that you're born. As you get older, it's still important to think about calcium and vitamin D supplementation. Those are very important. Calcium is what gets into your bones, and vitamin D is what helps the calcium get into your bones. So I tell people, even in their 20s and 30s, think about getting calcium from your diet. Vitamin D probably will need to be in supplementation form. Because it's very hard to get from the diet. Exercise, exercise, exercise. An endocrinologist's favorite thing to tell her patients because it's important for not only your bone health, but your body. I always tell my patients, good bones, good body, good bones. So that's very important. And the type of exercise that we recommend is what's called weight-bearing exercise. And weight-bearing exercise is anything where you're standing, walking. So it can be as simple as walking, running, Zumba.
Ooh, that's fun.
Yes.
Yes, dancing.
So dancing, exactly. Those are all great activities, weight-bearing activities. But we're also encouraging strengthening activities. And those include things like Pilates, some gentle yoga, Tai Chi, things that also improve your balance. If you're less likely to fall, you're less likely to break a bone.
Some great advice. Thank you so much, Dr. Misra.
Thank you.
From Stanford Health. For more information about Osteoporosis Awareness Month, just head to WTNH.com, click on the Honor tab, and pull it down to the Good Morning Connecticut Weekend section.